Doctor just said my child has a weight concern. Now what? You may have just been at a well check or another visit, and the pediatrician flagged that there's a concern about your child's weight. You may have smiled, nodded, heard some of what they said, and drove home in a panic. What to do next? I'm Dr. Natalie Muth. I'm a pediatrician, registered dietitian, and obesity medicine specialist. I spent 13 years in pediatric primary care and started a healthy weight clinic and had thousands of conversations with children and their families about weight and related concerns. I pivoted to start Namio Health so I could just help support more families on this journey. So oftentimes this can be the number one kind of triggering moment. Studies have shown in the past that less than a quarter of parents who have a child that has struggled with their weight recall a doctor ever flagging it. So when it does happen, parents are often blindsided and don't know what to do next. And more, clinicians are talking about weight with families. There's clear guidance that we really do want to recognize concerns early so that we can help to treat them early. And sometimes these conversations go very well and are very supportive, and sometimes they can be pretty trying. So I'm going to help you navigate. You got this information, you headed home, took a few deep breaths, and what to do next. Well, there's really three things I'd like you to think about. Number one, how's your child doing? Your child was probably in the room when this conversation happened, and you want to get a better sense of where they're at and what they're thinking. So with permission, I would ask your child if it's okay to talk about the visit. And once they say it's okay, then ask an open question. How are you feeling about how that visit went? What's on your mind after that appointment? Really try to get a sense of where they're at, what they're thinking, and really first just listen. This is really important. We can't ignore how a child is thinking about or processing this information, because if it's ignored, they're likely to internalize it and maybe take matters into their own hands in an unhealthy way, like restrictive eating or dieting. So really have that conversation early on and let them know that you are there for them and you are support to help them to optimize their overall physical and mental health and well-being. It's not about weight, it's about the health. Which leads me to number two. What are you going to do as the next steps to really get a better sense of what their health is? Well, if your child's 10 or older, and sometimes even if they're younger, the clinician may have recommended to get some additional labs done. This is stuff like cholesterol, liver tests, blood sugar, checking blood pressure. There are some conditions that can go alongside increased weight, and it's really important that we know this information early on so we can take the best steps to help address it. So I really encourage you to follow up with those recommendations. Go ahead and get the labs done so you can get a more complete picture of how things are going for your child. And we're learning more and more that the earlier these things happen and are of concern, the more important it is for us to do something early. But also, even when labs are normal, if we don't address the concern later on, there's likely to be abnormal labs. So we really do want to get these done and then take next steps, regardless of whether they're normal or not. But the results will help us to know a little bit more about the urgency. And then third, very important, don't delay in helping to get some supports to make some changes to help your child optimize their health. Now, a lot of times the initial supports are going to be around things like nutrition and physical activity and strategies to change behaviors or routines and schedules a little bit. These things can be really helpful and they're foundational, and getting extra support to be able to do this is really important. And in fact, studies have shown that having a comprehensive program that's guided with support in these areas can really make a significant impact. And full disclosure, that's part of why I made my pivot to Namio Health to help build something like this so that more families would have access to it. Now, in some cases, especially for adolescents, or if the weight concerns identify a more severe or a more significant level of increased weight or obesity, then there may be conversations about medication options as well to go alongside that behavioral support. So really important to have that conversation with the clinician, understand all of your options, understand the community resources and supports that may be available to you and your family, so that you together as a family can make some small changes that can add up to big differences. So tell me, have you ever had a conversation like this in the office where maybe you got information about your child's weight? What did you do with it? I'd love to know. Please drop your comments, information in the comments. Thank you.